So we're here today with Alex, who's 26 weeks pregnant, and she's come in with some pain around the back of her pelvis, which we've diagnosed as pelvic girdle pain. Pelvic girdle pain can be pain anywhere on the back of your pelvis, between the top of your iliac crest here, so your hip bones, and what we call the gluteal fold, or the line just below your buttock. It also includes any pain on the front of your pelvis, which can arise from this joint at the front here called your pubic symphysis. It's really common to occur in pregnancy, likely from the changes occurring in your body from growing a healthy baby. But we used to think it could be just from hormones, whereas that's not the case anymore. So just because you are pregnant doesn't mean you're going to get pelvic girdle pain, it's just more common. In terms of management, there's lots of things you can do. One is to keep active and keep moving, which is really important. The other thing that can help some women is to think about pelvic symmetry, so trying to avoid positions where you might be loading just through one leg only. So that's commonly standing on one leg to put on your shoes and socks, or put on trousers and your underwear and things like that. So it's really important to sit down and do those activities, because it might just reduce a little bit of the stress up through your one of your pelvic joints through there. Other things you can think about doing is when you get into your car is sort of, rather than sort of leaping in with one leg and then the other, is sort of sitting in onto the side of the car and then kind of imagining you're wearing a bit of a pencil skirt to bring yourself around a bit. One of the things is trying to minimise your use of stairs, up and down sort of hills or uneven surfaces as well, not going through like beach walks on really soft sand. Those sorts of things can be really useful. Sometimes sleeping at night, if you're a bit uncomfortable, you might already have a really great pregnancy pillow, but you can also have a pillow between your knees just to keep things a bit more even through your hips. So those are some things to try that might work for you. Other things is putting ice directly on sort of that area wherever you're getting a little bit of that pain. Sometimes ice works best, but sometimes heat works as well for certain ones. So just try and see what works best for you in terms of heat packs. And then other things that we can use, sometimes using a support belt or SRC shorts can be really good. So we've got a belt here today. So you can get these from your physio. And so I'll get you to stand up on it. So generally, I'm just going to give you a bit of a hug. Generally, you pop the belt low, just below your belly, around those pelvic joints that I just showed you with the model, and you just do that up so it's firm but not too firm, and then taking these butterfly straps that we've got either side through here. Usually I get you to do this yourself if that's okay, so I get to hold both those and just pull them both really firmly forwards. Excellent, sticking them down onto there. And that should feel pretty supportive around your pelvic joints through there. Does that feel okay?
Good.
Yeah, good. So if we imagine we've got that belt encircling now around the pelvis, around these joints through here, on the back and around onto the front, which can help to just support them a little bit and just feel a bit better and help you move a little bit better as well. Usually you wear that for movements when you're going for a walk or you're doing chores around the house. And if you're going to be sitting for a while, like you get to work and you're sitting at a desk, then you just another great thing for long-term management of this and to prevent sort of issues after having the baby is obviously Pilates and to keep strengthening and keep active. So again, if you're not sure what kind of exercise might be best for you, is to come and see your physiotherapist.